This is another flat man model that I'm going to do both the arteries and veins on as a review. Now let's start here with the heart. Remember, we have three great vessels coming off the superior of the heart. P-A-S, PAS. Pulmonary trunk, aorta, and superior vena cava. The pulmonary trunk, if you remember, sends these pulmonary arteries to the lungs to get oxygen. And these are the only arteries that are blue. But they're arteries because they go away from the heart. That's what arteries are, away from the heart. And then these red ones here in the lungs are the pulmonary veins, taking oxygenated blood back to the heart. But they're veins because they're going to the heart, and that's what veins do. From now on, all arteries will be in red and all veins will be in blue. I'm going to take the front of the heart off here because I want to point out to you that the first branch off the aorta are these two little ones here. We just got oxygen in the blood, so the first place the heart is going to send that oxygen is to itself. So we have the coronary arteries here coming off the aorta. I'll put the heart back on, and you can see all these coronary arteries in red. And then we have coronary veins too, taking blood back to the heart after we use up the oxygen. So now let's follow the aorta. Remember I said the aorta has ascending aorta, which becomes the aortic arch. Now off the aortic arch, we have these three branches. On the left side, left because there's the tip of the heart, we got to supply the arm and neck. So this would be the common carotid. This would be the left subclavian here. As soon as the subclavian goes under the clavicle into the armpit, it becomes the axillary artery. As soon as it hits the humerus, it becomes the brachial artery. When it comes down here, the brachial artery is going to split and come to the thumb here, so that's the radial artery. Going to go to the pinky finger here, the ulnar artery. Now on the other side, the right side, we didn't have a common carotid and subclavian right away. We had this little trunk between here and here called the brachiocephalic trunk, because it's still going to the arm brachio, it's still going to send a branch to the head cephalic. So this is the right brachiocephalic trunk from here to here, not very long. And then, sure enough, that's going to split to the common carotid on the right side and the right subclavian. Now, when we get up here, the common carotid is going to split into internal and external up here. And you can see this one branch is going deep. So that's the internal carotid, whereas this branch off the common carotid is going to go superficially to the external of the skull. So that's the external carotid there. So let's follow this subclavian. Come around. As soon as it gets the armpit, axillary, top of the humerus, brachial. Going to split here. Looks like that's going to the radial thumb. That one's going to go to the ulnar pinky. Now we're going to come down into the abdomen. So the aortic arch, when it curves downwards, actually goes behind the heart. That's the descending aorta. Within the thorax, you can also call it the thoracic aorta. The descending aorta comes through this diaphragm muscle here. We can still call it the descending aorta, or since it's in the abdomen, we can now call it the abdominal aorta. I said you have three branches off the abdominal aorta, three trunks. And we had 1, 2, 3. Singular trunks. This is the celiac trunk. Remember I said CSI. Celiac trunk, superior mesenteric, inferior mesenteric. Celiac trunk is going to have 3 branches. This one going to the liver is hepatic. This one going to the spleen is the splenic artery. And this little branch coming straight out after its celiac trunk, that's actually going to branch. They show that on the other flat man. And this region, which is going to be the stomach, so it's going to be the gastric artery coming off in this area. You can see the esophagus coming down here, so the stomach would be here. That's the C, celiac trunk with 3 branches. Then here, superior mesenteric going to superior part of the intestines, inferior mesenteric going for the inferior part of the intestines. Then we have 2 bilateral branches. Renals, right and left kidney, and these long, thin branches going to the gonads, so they're the gonadal arteries. Then we get down here. This little tip here coming down the middle is the sacral artery. You can see the sacrum there. But as soon as the abdominal artery ends and splits, we call these the common iliacs. Common means it's going to split into internal and external. Well, the internal has to go deep. The external iliac is going to come out and exit the hip. As soon as the external iliac exits the hip and hugs the femur, it's going to be the femoral artery. Then the femoral is going to come down behind the knee. They don't show it on this side, but they do on this side. So let's follow this side. Common iliac, internal iliac, external iliac, femoral, change the name to popliteal behind the knee. And now we got the posterior tibial. We also have a branch coming here, which becomes the anterior tibial. We have a branch on top of the foot called the dorsal pedalis. We can see that here, coming off the anterior tibial, dorsal pedalis. That should do it for the arteries that we're going to learn. This is the gluteal artery going back up to the gluteus, buttocks muscles. Now, the veins. Veins are going to the heart, but we're going to learn them like they're based on the arteries that they're close to. So we'll follow them the way we did the arteries, even though they're coming back to the heart. So here, to the aorta, we have the superior vena cava. We have a right and left brachiocephalic trunk this time. And this time, the brachiocephalic trunk is going to branch to the head and the arm again, but we're calling the one draining the head the jugular vein, and this subclavian here. On this side, you can see the brachiocephalic vein here, jugular vein, and subclavian vein. Now, some models do have the internal jugular and external jugular separate. The other model, we had a jugular coming up, which then split, went deep to be the internal jugular, went externally to become the external jugular. In this case, these are both jugulars, but you can see this one is external because it's going to outside of the skull, whereas this one's going to be deeper into the brain, draining the brain. So that would be the internal jugular. This would be external jugular. Now let's follow the subclavian vein. Here we come, subclavian vein, axillary vein. There, let's follow this side. Here's where we split, so that's subclavian vein, axillary vein. Now we follow the axillary vein on down. This is the one that becomes the brachial. Just like on the other flat man, for some reason they cut off the brachial vein so they can show some other veins, but it would follow the brachial artery on down. On this side, it would be right here. Because remember, that's the brachial artery, so that would be the brachial vein. I wish they left it on there. But then we learned 2 extra veins over here. The vein on the head side of the brachial would be the cephalic vein, and the one on the bottom or base side would be the basilic vein. And then we said the cephalic and basilic joined here at this median cubital vein in the middle of the cubital anterior elbow area, and that's the one they take blood from. This side, axillary, this would be the brachial. It would come on it down here. But then we have cephalic vein, and here would be the basilic vein coming down here. This would be median cubital in this case. And then we have radial vein, ulnar vein. In the trunk, we still had trunk area, meaning the torso area, the abdominal area. We have the inferior vena cava now, here. And we have, instead of having these three singular trunks coming off of there, we only have the renal veins draining the kidneys, and we have the gonano veins. Now these are the gonano veins here. It looks like chains, kind of. And this gonano vein actually goes up into the vena cava, whereas this gonano vein, long, thin, coming from the gonads, actually comes up and joins the renal. But they follow the gonano veins, gonadal arteries, I mean. Now the reason we don't have the trunks like we did over here is because, remember, we have the hepatic portal vein system. So the hepatic portal vein system is going to be shown in purple. So once again, we're going to drain the spleen, the stomach, and the intestines, and we're going to send all this blood to the liver first for detoxification, storage, and metabolism. So just follow these veins. Spleen here, so that's splenic vein. This would be where the stomach is again, so that's the gastric vein. And then we have the mesenteric veins coming here. They're all going to join. Where they join, right here, is the hepatic portal vein, door into the liver. Once the liver is done with that blood, it's going to send it back out here through the hepatic vein into the vena cava. So hepatic portal vein is purple, and it's on the underside of the liver, whereas the hepatic vein is going to drain to the vena cava, and it's going to be on the superior side of the liver. Once we get down here, the vena cava ends. We have the common iliac vein until it splits into internal iliac and external iliac. Down here, we're going to have the external iliac continuing as the femoral. Here's a branch going off to the gluteal area, so that's the gluteal vein. And don't forget, we have the longest vein in the body, has to be medial, it can't be on the femur. The great saphenous vein, all the way down to the foot. Center one, again, is the femoral vein. It's going to go behind the knee to be the popliteal vein. It looks like it could be that one, but it's not. That's the great saphenous. It'll be right in this area, and then we got the tibial veins there. We have a dorsal pedalis vein as well. All right, that should cover the other flat man as a review.